Welcome to Decode Health with Dr. Ritesh. Today we are going to talk about a very specific topic that can type 2 diabetes be reversed. So can diabetes really be reversed, or it is just a myth? What if I tell you that in some people diabetes can go into remission without lifelong medicines? Let's understand the science in the simplest way possible. Hi, I'm Dr. Ritesh. I'm a medical specialist and diabetes is my special field of interest. So very frequently we are asked this question by the patients: is my diabetes reversible? And there are many programs running, which recruit diabetic patients promising reversal to everyone. Some of them are promising positive results in 95 to 99% of patients, which actually is misguiding them because it is not for everyone and not everyone is a candidate to achieve a diabetic remission. Today, let's decode this. So in this video, we will cover what is diabetic remission, how it happens inside the body, and who can actually achieve it, and what actually works in that case. So first, let's be very clear. Diabetes reversal does not mean cure. It is defined as your blood sugars becoming normal, that is your HbA1c coming to less than 6.5% without medicines for at least 3 months. And this is called remission and not reversal because it is not permanent. And if the lifestyle changes are discontinued later on, then the diabetes will come back. That's why remission and not reversal. In this section, we discuss the most interesting part: what causes diabetes and how can we reverse it? So there are many theories. So here we discuss a concept called the twin cycle hypothesis. So the cycle 1, fat builds up in the liver. The liver, it starts producing more and more glucose, and your fasting blood sugar, it goes up, causing diabetes. And in the similar cycle 2, the fat, it builds up around the pancreas. So this visceral fat around pancreas, so it will damage the insulin producing cells, which will not work properly, and the insulin secretion hereby decreases. So diabetes is not just a sugar problem. It is a fat problem in the liver and in the pancreas. And when you lose weight, this fat reduces. Both these cycles, they reverse, and hence the blood sugars, they improve. So now in this section, we will talk about the proof that the theory works. So the first one is a famous study called the DIRECT trial. So in this, the patient were given a very low calorie diet of around 800 to 850 calories per day. And those who lost around 15% of the body weight, of that 80 to 85%, they achieved remission. In the second case, there is this bariatric surgery, procedures like sleeve gastrectomy, Roux-en-Y procedures, gastric bypass. So they can also lead to remission in almost 60 to 80% of the patients. Again, through weight loss. Through significant lifestyle changes alone, still 10 to 15% of patients can achieve remission, although success rate is pretty less here. Now the big question: can everyone reverse diabetes? The answer is no. You have a higher chance if 1. Your diabetes is recent, that is less than 5 to 6 years. This is the most important part. Logic being that in such cases, your insulin producing cells are relatively preserved. For remission, we need that the insulin production is potentially near normal. So when we reverse the pathophysiology, body's own insulin production can take care of the increased blood sugars. Second point is that your BMI is above 27. This is a critical step. The logic is that in these patients you have enough potential or scope to lose significant weight. You do not expect a patient with a BMI of say 22 to lose a lot of weight, obviously, right? The third point is your pancreas are still producing insulin. The logic is that we just discussed that insulin should be sufficient enough to control sugars if we take care of the underlying disease process and increasing insulin sensitivity. So if there is enough insulin, the reversal is possible. Fourth, that you are not on long-term insulin. Logic here being that usually such patients are long-term diabetics and have been on multiple medicines. So reversion will not be possible. And a most important factor here is weight loss. If you lose more than 10 to 15% of your body weight, your chances of remission, they increase significantly. Next section. Now, what about medicines? So yes, there are some newer drugs which help in weight loss, and that is how they support the remission process. They don't directly reverse the diabetes, but they help create the conditions for remission. So what should you focus on? No shortcuts. Absolutely not. We aim for a sustained weight loss, calorie control, regular physical activity, and yes, early action. The earlier you act, the better your chances are at remission. So yes, diabetic reversal is real, but it's not magic. It needs the right patient and the right effort. If you found this helpful, please like, share, and subscribe. So it will help us reach more and more such patients, such people who actually need this. Thank you. See you in the next video.